Welcome back to Learning Anatomy with Dr. Bakare. And if you are visiting this space for the first time, you are also highly welcome. This is quiz time, and in this section, we would be looking at questions that are related to the perineum. I have put up a lecture on the perineum. If you've not checked that lecture up, please kindly go and do so before attempting this quiz. The first question we'll be looking at reads, which of the following statements concerning the perineal triangles is correct? We know that the perineum is further subdivided into two triangles. We have the anteriorly placed urogenital triangle and the posteriorly placed anal triangle. So let's go through these statements to see which is correct. The first one reads that the anal triangle is more complex than the urogenital triangle. The second option here reads that the apex of the urogenital triangle is directed posteriorly. The third option here reads that the urogenital triangle is more complex than the anal triangle, while the last option here reads that the apex of the anal triangle is directed anteriorly. So out of all these listed options, the correct option here is the fact that the urogenital triangle is more complex than the anal triangle. We know that the anteriorly placed urogenital triangle is compartmentalized into the deep and the superficial perineal pouches. And this is why this triangular space is more complex than the posteriorly placed anal triangle. So this option here is the correct option. The second question, which reads that the deep and the superficial perineal pouches are separated by what? So which structure is seen to separate these two pouches that are located within the anteriorly placed urogenital triangle? Is it the perineal membrane? Is it the superior fascia of the urogenital diaphragm? Is it the pelvic diaphragm? Or is it the fascia of the obliterator internus muscle? The correct option here is the perineal membrane. The perineal membrane is seen to border the deep perineal pouch and also the superficial perineal pouch. So it is seen to be separating these two pouches located within the anteriorly placed urogenital triangle. So this is the correct option here. For the third question, which reads that the urogenital diaphragm is structurally made up of the following, except, is it except the levator ani? Is it except the external urethral sphincter in both the male and the female? Or is it except the sphincter uretrovaginalis, which is specific to female? Or is it except the deep transverse perineal muscle, which of course is common to both the male and the female? So all these listed structures are seen to form the urogenital diaphragm, except the levator ani muscle. So the levator ani muscle is the correct answer here. All the other options that are listed are structural components of the urogenital diaphragm. So the fourth question reads that the following are contents of the anal triangle, except, is it except the anal canal? Is it except the vaginal canal? Is it except fat pad? Is it except the inferior rectal vessels? So the correct option here is the vaginal canal. So the vaginal canal is not seen to be contained within the posteriorly placed anal triangle. The vaginal canal is seen to open into the anteriorly placed urogenital triangle. So for the fifth question, which of the following statements concerning the boundaries of the Ischioanal fossa is correct? Is it the fact that it is bordered anteriorly by the anterior border of the urogenital diaphragm, or it is bordered medially by the fascia of the obliterator internus muscle and also the ischial tuberosity, or it is posteriorly bordered by the sacrotuberous ligament and also the gluteus maximus, or is it laterally bordered by the external anal sphincter? So out of all these options listed, the correct option here is it is posteriorly bounded or bordered by the sacrotuberous ligament and also the gluteus maximus. These two structures are seen to form the posterior limit of the Ischioanal fossa. Hence, this is the correct option. For the sixth question, the ischioanal fossa contains fatty tissue. The ischioanal fossa contains the Alcus canal or the pudendal canal. The ischioanal fossa contains the internal pudendal vessels and also the pudendal nerve, or is it all of the above? The correct option here is all of the above. All the above listed structures are seen to be contained within the ischioanal fossa. So the correct answer here or option is all of the above. The seventh question, the deep perineal pouch contains the prostatic urethra in male. Is it the Bartholin's gland in female? Is it the inferior rectal artery? Or is it the bulbourethral glands in male? The deep perineal pouch is seen to contain the bulbourethral glands in male. For the first option here, the deep perineal pouch is seen to contain the membranous part of the urethra in male and not the prostatic urethra. Also, in female, the Bartholin's gland is seen to be contained or positioned within the superficial perineal pouch and not the deep perineal pouch. The inferior rectal artery is located within the posteriorly placed anal triangle. So out of all the options here, the bulbourethral glands in male is what is seen to be contained within the deep perineal pouch. And as a matter of fact, it is positioned on both sides of the membranous urethra. This we've highlighted in our lecture on the deep perineal pouch. For the eighth question, which reads that the superficial perineal pouch is located between the dash and the dash. Is it located between the perineal membrane and the cos fascia? Is it located between the carpus fascia and the skin? Is it located between the perineal membrane and the skin? Or is it located between the fascia of the obliterator internus and the skin? The correct option here is the perineal membrane and also the cos fascia. The superficial perineal pouch is seen to be positioned between the superiorly placed perineal membrane and also inferiorly placed cos fascia. So it is located between these two structures. The ninth question, the perineum is mainly innervated by what? So what nerve is seen to provide the main innervation to the perineum? Is it the femoral nerve? Is it the pudendal nerve? Is it the superior gluteal nerve? Or is it the nerve to the obliterator internus? The correct option here is the pudendal nerve. The pudendal nerve is seen to provide the main innervation of the perineum. And this is the correct option. So for the 10th question, the following statements concerning the perineum are true except the fact that the deep limit is by the pelvic diaphragm? Is it except the fact that it is bounded posterolaterally by the sacrotuberous ligaments? Or is it except the fact that it is bounded posteriorly by the pubic symphysis? Or is it except the fact that it is divided into the urogenital and also the anal triangles? So all these options concerning the perineum are correct, except the fact that it is bounded posteriorly by the pubic symphysis. The pubic symphysis is located in the anterior region of the pelvic cavity, so it cannot be seen to be forming the posterior boundary of the perineum. So this is the option that is incorrect concerning the perineum. The 11th question, the pudendal canal or the Alcus canal is formed by. Is it formed by the perineal membrane? Is it formed by the superior fascia of the pelvic diaphragm? Is it formed by the skin? Is it formed by the fascia of the obliterator internus muscle? The correct option here is the fascia of the obliterator internus muscle. For the 12th question, the perineum is divided into two triangles by an imaginary transverse line drawn between the. Is it an imaginary transverse line that is drawn between the pubic symphysis and the sacrum? Is it between the two ischial tuberosities? Is it between the two iliac crests? Or is it between the pubic symphysis and the coccyx? So out of these options, the correct option here is between the two ischial tuberosity. An imaginary line that runs from one ischial tuberosity to the other is seen to divide the perineum into the anteriorly placed urogenital triangle and the posteriorly placed anal triangle. So this is the correct option here. So thanks for watching this video, and let's have your grades in the comment section.